Hi, and welcome to Mrs. Byerly's 7th grade health class. And today we're going to talk about how tobacco can affect the body. Okay, so really quick, some facts about tobacco is that in tobacco there is more than 4,000 harmful chemicals that are in tobacco. So when somebody actually takes a puff of tobacco, there's thousands of chemicals that are coming into a person's body. Okay, some of those chemicals can actually cause cancer in people, and about every single year we have roughly 400,000 people who are dying from some sort of smoking related illness, which we'll talk about a little bit later. So what tobacco is, it's a harmful substance. Okay, some of these, what happens is that it's a plant that grows, and when tobacco companies are preparing tobacco, they're actually adding more chemicals into the tobacco product. Okay, this picture kind of shows you that. It takes you through like what's found inside. So for example, like a household item that we might have around our house, toilet cleaner, there's also ammonia inside that. It's also found in toilet cleaning. Poison, so arsenic, we have it in rat poisoning. Okay, that's also found in a cigarette. So there's a lot of things that are around our everyday household items that are in a cigarette. Not something I want to put in my body. Okay, so the issue with tobacco is not necessarily about the chemicals. Okay, most people are going to say, oh, those chemicals, I want to stop. But when people start smoking, this is what gets them. It's the nicotine that are inside. Okay, so nicotine is an addictive, habit-forming drug found in tobacco. It makes it very, very hard for people to stop smoking. This caption kind of sums it up very nicely. And it says, I just thought I'd drop by personally and congratulate you on your accomplishment. No one has ever quit smoking 17,000 times in 1 year before, which we all know that, there's 365 days in a year, okay? Nobody, so in other words, what this is saying is, when you take a puff of tobacco, and they say this is my last cigarette, what it is like, oh, I'm out of my cigarettes, I'm out of nicotine in my body, I want more, and it craves it. So that's why it's really, really hard for people to stop. Okay, so this is tar. So when tobacco burns, like when a cigarette, for example, is lit, okay, tar is being produced. And, tar, we think about what we use on the roads to fill in patches, okay, not something that's going to coat our lungs like you're seeing here in these images, okay, but that's what it's going to do. Tar is a thick, dark liquid that forms when tobacco burns. Okay, it's going to coat your airways and your linings of your lungs. If you can see these images, we have a smoker and a non-smoker. I would assume that, the non-smoker died of natural causes. Okay, unfortunately, I would assume that based on what these lungs look like, the smoker unfortunately passed away from some sort of smoking-related diseases. Okay, there's many different types of tobacco, different forms. Okay, so we have cigarettes, cigars, pipe tobacco, and smokeless tobacco. This is what actually tobacco looks like, though. Okay, it's a plant, and tobacco companies are going to cut it down. They're going to dry it out. They're going to hang it upside down, as you can see from this wagon, and then they're going to take it back to, their shop, whatever, factory, and cut it up really finely to put into cigarettes or other types of tobacco forms. Okay, so again, here are some of the kinds that we just talked about. Okay, cigarettes, tobacco, and cigars, those are the type of tobacco products that are going to be inhaled. Okay, so it gets inhaled, the smoke gets inhaled into the lungs. Okay, smokeless tobacco, however, is something that is going to be, it's going to go in between your teeth and your gum. And people are going to get the nicotine through the digestive system into the bloodstream. Okay, so those are a little bit different than one another. Okay, so it's really important as we're moving forward that we can understand the words short-term and long-term. If we're looking at short-term, we're talking about like right now in the moment. So if somebody was to light a cigarette or they were going to use smokeless tobacco, right now these are the side effects they're having from it. Okay, long-term is a little different. Long-term is what we're talking about over a course of time. So, if this person was smoking or using smokeless tobacco for many years, okay, not even years, maybe months, things can happen where, there's long-term effects that can result from that. So with that said, with short-term effects, again, short-term, like right now in the moment. So when people are using that, these are the things that can occur. So they can get an addiction to nicotine. Nicotine is an addiction. They're going to have it. Okay, maybe there's tooth decay from it. Okay, they're going to develop some sort of cough from putting that tobacco into their mouth. Okay, maybe they're going to get some smelly hair from it. It's not a very pleasant smell if you've ever smelt it. Bronchitis and asthma into the lungs. Decreased lung capacity. So it makes it really hard over a course of time for people to do those type of things. Sensitive and stained teeth. Bad breath, bad taste in the mouth. As you notice, if you're going through this, there's a lot of mouth effects, and that is due to the simple fact that it's pretty much where tobacco is going to go. It's going to go into the mouth, whether it's smoke, like a cigar, or pipe tobacco, or cigarette, or even smokeless tobacco. It's going into the mouth. Damage to the respiratory system. So again, that's like into our lungs, and that can have some permanent damage, which will lead into long-term sores or patches and lumps in the mouth, maybe receding gums and permanent gum loss. If we're looking at long-term, okay, maybe somebody had a stroke. Okay, from it, stroke is when we're thinking about the brain, so not getting enough oxygen. Okay, smoking actually depletes the body of the oxygen it needs. Emphysema, which we'll talk about in this PowerPoint in just a little bit. Heart attacks can occur due to maybe high blood pressure, those type of things. Chronic bronchitis, again, going back into the lungs. Maybe there's some blocked blood vessels in there, narrowing of the arteries. So instead of the blood being able to pass through those arteries, it's starting to get more narrow. Hypertension is just a medical terminology for some high blood pressure. Maybe the heart is not pumping the way it's supposed to, so it's weakening. And then it can lead to tons and tons of different cancers, whether it's lung, respiratory, cervical, stomach, mouth, throat, pancreas, kidney, bladder, larynx. There's a lot of others that it can do as well, but here are some. Looking more into our body systems with these effects. So when somebody smokes, their skin also is going to be affected. Okay, their breath, their hair, their clothes are going to smell like smoke. People will say that, they don't have, over a course of time, they don't have any sense of smell anymore. They've lost the taste to foods. It also can affect different body systems, which we'll get into right now. One of these is the respiratory system. So again, over a course of time, if somebody is smoking, it's going to damage their lungs. That smoke which has so many chemicals in that we just talked about. Okay, those are going to damage something that's called the alveoli. These are like the tiny air sacs in our lungs. And when that happens, as you can see from this picture, kind of like shows the destruction path of it. And unfortunately, it can lead to something called emphysema. So emphysema is a disease that results in the destruction of the alveoli in the lungs. I think people take for granted what we can do, just by getting up and walking across the room. Okay, people with emphysema, they can't do that. Okay, it's very hard for them. They feel like very out of breath. It takes the fun away. Think about when we laugh. We use a lot of oxygen and we don't think about it. But then, people who have emphysema, they start laughing and they have to stop right away because they have no oxygen. The digestive system. Now I could have went with a more crazy picture. but these are just showing you some of like the teeth and how it can get stained. So, but anyways, our teeth and our gums can get yellowed, okay, making it more likely to get some sort of disease. The gums or maybe cavities can cause. Again, we talked about the taste buds starting to dull. Maybe it causes ulcers in our stomach. Okay, lots of, again, cancers that can be linked to it. The nervous system, like I said, when somebody smokes, it depletes the body of oxygen. So this image right here is kind of showing you the amount of oxygen in somebody's brain when they had 0 cigarettes in them. Okay, after 1 puff, which is the next brain to the left, okay, it's kind of showing you the depletion of it, to 3 puffs, to 1 cigarette, to 3 cigarettes. So again, when somebody doesn't get the oxygen they need to any body system, but definitely to the brain, okay, a stroke can occur. Okay, and then the circulatory system, okay, which is like our heart. So tobacco is linked to heart disease. Okay, increases our chance to have a heart attack or our heart stops working. Okay, and it can raise our blood pressure. So there's a lot of side effects, whether it's short and long-term effects that can occur from using tobacco. A lot of the resources that I've used in this are on our Weebly page, so please check that out. Hopefully you learned something. Thank you so much.